Hey there, Mission. I'm Tim Brown from Rick Brown Family Funeral Home, and I want to invite you to join me on Commerce Conversation, the business, community, and innovation here in Mission, Texas, the official podcast of the Greater Mission Chamber of Commerce. You know, each episode, we're bringing you exclusive interviews with local business leaders, entrepreneurs, and change makers who are living right here in the Rio Grande Valley doing business here in Mission. They're driving innovation in our community. We will dive deep into the issues that matter to you, the business growth to community events and everything that comes in between. You can catch this podcast on YouTube, Spotify, and Apple Podcasts. Make sure to subscribe. Never miss an episode. If you miss one episode, you miss a lot, so don't miss an episode. We're excited to share the latest in business and community news with you. We'll see you on the Commerce Conversation. Welcome to a new episode of Commerce Conversation, Business, Community, and Innovation, where we talk about businesses here in the city of Mission. I'm your host, Tim Brown from Rick Brown Family Funeral Home, and today we're going to be discussing how South Texas Health Systems is dedicated to advancing healthcare access, fostering community well-being, and supporting economic growth here in our region. It's not just Mission. They're all over this region here. We'll also be exploring their journey of 10 years of settling in the city of Mission, hiring medical professionals, and providing quality care for our local community and throughout the RGV. But before we get started, I want to talk a little bit about our golf tournament that's coming up. This golf tournament we do, it's an annual golf tournament, and we always support the Mission CISD. So our sponsors are very important to us. And, this year's title sponsor, again, I believe they were our title sponsor last year as well, but is Cano & Sons Trucking. We're grateful for them. We're grateful that we can have an impact on the students here in Mission because of their donation and their sponsorship of this golf tournament. But the golf tournament's coming up. If you want to put a team in, you better hurry. I hear they're filling fast. Call the Chamber of Commerce and get your team going on. Well, first of all, I want to thank you all for tuning in. We obviously want you to be a member of the Mission Chamber of Commerce, the Greater Mission Chamber of Commerce. But if you're not, we're still glad you're a listener. We hope that you learned something from today. Today, I'm joined by Lance Ames. He's my good friend. I've got to know him actually through networking here at the Greater Mission Chamber of Commerce, but he's the South Texas Health Systems Edinburg and South Texas Health Systems Children's CEO. Lance, welcome.
It is an honor to be here with you today. Thanks for having me.
Well, I'm excited. Every time I see you, Lance, I got a smile on my face. Something about you makes me happy, and I'm glad you're here. I think we're going to have a great time, and I think this is just going to be fun today.
It's going to be a lot of fun, and we're grateful for all you're doing to help educate our community through this podcast. There's so much great going on in Mission, and the Mission Chamber and you through this podcast are really doing a great job.
Well, thank you. I appreciate you saying all that. So Lance is not a native from here. He's much taller than all of us natives. But how tall are you, Lance?
6'3.5".
6'3.5". Give it a few years, you'll come down to 6'3". I'm sure you're fine. So, Lance, you were telling me earlier you've been here for 12 years.
Yes.
So, did you start off as the CEO of Edinburg and Children's Hospital, or is that something that you've worked your way up during the last 12 years?
I've worked my way up.
Okay.
Came here 12 years ago as the associate administrator with South Texas Health System Edinburg, and I worked as an associate administrator too at the McAllen campus, and then actually got my first opportunity as an interim CEO at our South Texas Health System Heart Hospital.
Really?
And then after that time, I took a role over ambulatory services for South Texas Health System and helped open 4 out of our 7 freestanding ERs throughout this area.
So you have a little experience with South Texas Health System.
A little bit.
Yeah. Well, I didn't realize all that. That's amazing. And so all that you just mentioned in 12 short years.
That's right.
Well, how exciting. Give us a little history of South Texas Health Systems. I'm sure in 12 years you've heard some of the history, but, growing up here in the Valley, we all called it the White Hospital. That's McAllen Medical is what it was known forever. And I believe it's transitioned now to South Texas Health Systems McAllen. But that was the hospital that all of us knew growing up. So give us a little history about y'all's involvement here in South Texas.
Sure. And, the funny thing, I still do new employee orientation, and I'll still ask, hey, does anyone know the El Hospital Blanco? And everyone still knows it. So
Everyone still knows it.
How it goes.
It hasn't been white in how many years?
Many years. But, South Texas Health System has been in the community for a long time. Our first hospital is actually the South Texas Health System McAllen campus. Our organization, Universal Health Services, came in and acquired that hospital and built it up to what it is today in 1985.
Wow.
And so after that, we added the Heart Hospital. And then in 1997, we added the South Texas Health System Edinburg Hospital. A little bit after, in 2006, the Children's Hospital. We also have a behavioral hospital. And over the past 10 years or so, we've added 7 different freestanding ERs. And the second one that we actually built was the one here in Mission.
Really? There's the second one. Where's
Mhm.
the first one at?
Weslaco.
Weslaco.
Yeah,
Okay. Well, next time we do it first, let's do it in Mission.
I agree. A lesson learned.
All right. So let's talk a little bit though, because you mentioned the behavioral health. You mentioned the Children's Hospital. Now, these are not part of other hospitals. These are actually freestanding hospitals. Is that correct? You have your freestanding Children's Hospital, and you have a freestanding behavioral health hospital.
Correct.
Okay, good. And oftentimes people think, well, it's just part of another hospital. You wouldn't get the same, but these are dedicated, and that's exactly what you serve. Is you only serve children, you only serve behavioral health.
Absolutely.
Good. Okay. So let's talk a little bit about Mission since that's where we're sitting today. All right. So South Texas Health Systems has been in the city of Mission with the freestanding ER. We just celebrated 10 years. Now, there was a video that was played during that ceremony, which really kind of caught me off guard. There are so many things that South Texas Health Systems does to that ER. How many people have y'all treated just in that little building there?
It's amazing to look back in all the lives that we've been able to touch throughout 10 years. But we've done the math, we've gone back, looked at everything, and we've treated over 200,000 people in that mission freestanding ER. And so it's really an honor for us to know that we've been able to impact so many lives in that way.
200,000 people. Wow. That is amazing. And being part of this community, it's hard to imagine that there's that many people that are in need of care, but there really are. And so I assume that not only are you servicing Mission out of that building, but obviously you're on the expressway, so I assume you service a lot of people out of Western Hidalgo County, maybe even the South Side. I assume that you all have a wide range of demographics that you service right there.
Oh, for sure. Yeah. We go north and west. A lot of people go to that location just because it is so easily accessible.
So explain to me what a standalone ER is. Obviously, you've been involved in developing some. So, I mentioned earlier trauma, level one, which South Texas Health Systems has one of two level one trauma centers in Hidalgo County. So are these level one or what exactly would you call a standalone ER? How are they or classified?
That's a great question. So they really are what they sound like. They are a true freestanding emergency room. So they function as an emergency room, just like you go to a hospital, any other emergency room. So we have a physician there 24/7. We have radiology capabilities, including CT, X-ray, even mammography and bone density for more outpatient. But there truly are every resource that you would need to have in order to get treated.
So you're talking about X-ray and
Mhm.
CT scans. So that would be done right there in that building. I'm not transferred anywhere else.
That's right.
Okay. Now, what if I got there and I needed additional care that was outside of the level that could be handled? What would happen to me?
Right. So, we try to take care of everything that we possibly can. But when there is a higher level of care that's needed, we do have wonderful hospital resources. We do work with the mission hospital, even. If there's a higher trauma, for example, let's say that's a really tough accident that happens, we do have the trauma level one facility in McAllen. And it's a great resource to be able to have if you do need that higher level to know that you will have access to that. So we use our specialists from the trauma level one center. We use our specialists from the Children's Hospital a lot. So if
Really?
you have a child that goes to the Mission freestanding ER, you can know that that doctor in the freestanding ER will be able to contact our pediatric specialists at the Children's Hospital in Edinburg. I think it's great to have a network of team that can support each other.
So basically, at one phone call, they got a wealth of knowledge at their fingertips.
Exactly.
Okay. So you said something that kind of caught me off guard. You mentioned the monography and all that because that's more of an outpatient. And so, a lot of times people are afraid to go to the ER because, the stigma of the price of an ER.
Right.
Okay. But do you also offer outpatient services there as well?
We actually do. And that was something as we developed the freestanding ER and Mission, we wanted to build something that was cheap, that was affordable for people because you don't want to have to pay the high hospital pricing for outpatient procedures. And so we actually do have very affordable outpatient pricing for all of our radiology, whether it's X-ray, CT, ultrasound. We also have bone density, we have mammography. And so you can go there and pay a very affordable outpatient price. We also have cash-based pricing as
Wow.
well for individuals who come. And also, I can't forget lab. So you can also go there for outpatient lab
Really?
pricing as well. Yes.
Well, that's good to know. No one ever likes to make the decision: do I go to the hospital or do I put my kid through
Right.
college? So it's good to know that there's something affordable here. So tell us a little bit about the impact that y'all have had on this community, and specifically, I want to talk about 24/7 care, which I assume y'all don't put a sign on the door, on Christmas and say we're closed. I assume you're open every day,
24/7
right?
every day.
And so, how has this transformed healthcare access, particularly for Western Hidalgo County? Because it seems like you hit Conway and you start coming this direction, you got good healthcare, but if you go that direction, there's not a whole lot. So, how has you're being the on the western side there? How does that change healthcare access to that side of the county?
Well, it's growing. We're growing very fast in this area. And so it really is all about access to care. And so adding a facility that has all the resources of a full emergency room really helps the citizens to be able to know that they can get the access to care whenever they need it. We have physicians on call that are able to support them. So if you need a general surgeon, if you need urology, if you need
Right.
neurology, we have physicians that are available to be on call to help whatever the specialized needs that you have are.
Wow.
It's really amazing.
That really is amazing. So I want to kind of do something fun here, and you may not be able to answer this. I'm going to catch you off guard, but can you share a story? And obviously, don't give us names. Or there's HIPAA laws. I want to remind you of that. But anyway, can you share any stories that maybe a success story or a life saving impact that the ER has had? And just for the record, last week or maybe a little longer ago, but you had a monster truck at the Edinburg Children's Hospital.
We did, yeah.
That looked fun. Looked like it might have been life changing.
I actually got to go into the cockpit of the monster truck, and
Yeah.
it was amazing.
I don't know that I could climb that high. I think
I barely fit in.
I was going to need an escalator, I think, to get that high. But that looked fun. I saw some pictures of it, and so then tell me a little. Let's talk about that for just a moment. So that's something that I guess you as a CEO kind of facilitated to put together. Monster Truck was here in town, so it looked to me like they brought a couple of trucks out. And it looked to me like some of the drivers actually went room to room and saw some of the patients that you had. Is that correct?
They did. They were so good and so kind to our kids that, they got these monster truck drivers that
Yeah.
are just legendary. And we actually had the top 2 drivers in the country
Wow.
that came to our hospital, and they went upstairs. They brought flags, they brought caps, they were signing autographs, and they went and took a lot of time just to visit our kids. And it meant the world to our kids. It meant the world to our staff. And so we're appreciative of any community organization that is committed enough to come and take care of our kids.
This might surprise you a little bit, but my favorite monster truck is Gravedigger.
Oh,
Legend. Yeah. Being in the funeral industry, Gravedigger that was the monster truck. But anyway, I love monster trucks. I think they're just fun, and I think that's amazing that they came out there. And good for you. Kudos to you for putting that on. And then recently, also, was it a 5K that y'all had?
We did, yeah. So we started a children's 5K that we've done for 3 years now. And it's kind of gradually grown.
Right.
This year we got up to over 250 participants in our race.
So why do we do that? Is that a fundraiser?
It is.
And where do the funds go?
This year we dedicated our funds to the South Texas Juvenile Diabetes Association.
Really?
So again, all the proceeds went to them. We think it's a really great way for us, again, just to give back to our community. So many people do so much for us, and we like to be able to give back.
Well, that's exciting. I love hearing stories like that. I think life is built on giving back to your community.
I agree.
And so I love to hear stories like that. Okay, so let's go back. Do you have any stories that you could share that maybe, I don't know, even your ER over at the Children's Hospital has made a difference in someone's life, or maybe a success story that someone has come back to talk to you about?
There's so many stories, and that's one of it's sometimes hard to work in a healthcare environment because you see so many challenging situations, but it's also such a blessing because you get to see the life-saving moments. And I'll share one.
Okay.
We had an employee at one of our hospitals that lives here in Mission and actually had a heart attack and came to the freestanding ER in Mission and was seen immediately. It was really kind of a scary thing for us, but again, we have the most incredible people that work in that freestanding ER. They were able to recognize what's going on very quickly. And then we have, again, a great partnership with our heart hospital. And I think the amazing thing is looking at this situation, they stabilized him, and then they were able to get him to the heart hospital and into the cath lab and have a balloon placement within 43 minutes.
Wow.
So the standard for the country is usually 90 minutes from arrival to an ER to getting a balloon placed for a cardiac event like that.
Right.
So again, even with the travel time, arrival to that freestanding ER here in Mission to the heart hospital to get a catheterization was
that's amazing.
3 minutes, and he's doing great. He made it out alive, thank goodness. But again, it's just one of those moments where, I'm really grateful that we have the amazing people, the talented clinicians that we have, and plus the protocols that we work so hard every single day to work on, so that we have consistently amazing outcomes and able to get the intervention as quickly as possible.
So 43 minutes, that's life changing.
It is.
Yeah. And very likely life saving.
Absolutely it
Yeah.
was.
Okay, so you've answered a lot of this already, this next question, but we're going to go a little bit further on this.
All right.
What makes the nurses, the board certified doctors, and expert personnel at South Texas Health System ER so special? And you mentioned that you were involved in the building of these ER, several of them. So when you're hiring someone, what is it you're looking for?
Number one, we're looking for people that are compassionate. We want to, when someone comes into our facility, the first thing that they should feel is warmth, compassion, a willingness to serve. And it's, sometimes I think in healthcare, it's like, oh, we've got so much going on. You're a burden to me. And, why do you keep asking for all these things? We want our staff members to be able to say, what more can I do? How can I help you? And we have a culture that's based on the word ACE-IT, and it stands for attitude, commitment, enthusiasm, innovation, and teamwork.
Okay.
And that is the cultural things that we look for in individuals when hiring them.
Similarly to what you're saying, I'm in the funeral industry, and so often we can become mechanical,
Right.
and that is very difficult. And I assume it's the same in the ER, is that you become mechanical, and I have a job to get done. I'm going to get my job done, but you forget that somebody on the other side is hurting. In my situation, somebody just lost their mom, their dad, their child, something to that effect. And I assume it would be the same in healthcare, is that, I've seen 4 heart attacks today. You're number 5. I just need to get my job done. But to be able to have that bedside manner is so important.
Yeah, absolutely.
Yeah.
Agree.
And so it's good that you look at that. And that seems to be from day one, from the application process.
Yep.
Yeah. How exciting. Okay. So let's talk a little bit about challenges and triumph. And I have no doubt that with the way funding has changed, with the way South Texas has changed, you've probably seen some challenges and you've probably seen some victories over the past few years. So talk a little bit about some challenges that you've experienced. You've been here 12 years, you've seen a few things.
Yep.
So what are some challenges, and then what are some victories that you've seen?
Yeah, I think being in the healthcare industry yourself, one of the biggest challenges that we've ever faced in our careers has been COVID. And that was something that really rocked our world. It was something very challenging for the community, but for healthcare workers and for people that were leading healthcare organizations, it was one of the hardest problems that we'd had to figure out how to solve. And I think we did an amazing job pulling together, and the kind of the aftermath of, once we figured out how to treat COVID and how to help people clinically, there were financial challenges. We lost a lot of healthcare workers. So we've had to be very creative on how to rebuild our healthcare workforce. And it's not just nurses, it's, radiology technicians and laboratory technicians and respiratory therapists. There's so many different important roles that we have within healthcare that we had to really strengthen and rebuild. So I think a lot of kudos goes to our leadership team for rebuilding those teams and getting to a place where we can take care of our community again in the best way possible.
I'll add a little bit to that just because of some personal anecdotes that I have. But during COVID, I was not involved, obviously, in the healthcare, but I was involved in people that passed away, and there were some issues that we'd see at hospitals, and so I made it a point to call and real honestly, everything was crazy at those times. That everybody was busy as far as in this industry, and I'd make a phone call and say, "Hey, we're having this issue," and it was fixed immediately. I mean, we're talking about within hours, if not minutes, someone was there to help us, and that really amazed me because everybody was busy. Now you talk about losing, staff. My wife she's an RN. And she was getting letters in the mail, unbelievable money to be a traveling nurse. And you started seeing people that were leaving. And it was really kind of sad because, in my mind, I thought, these are the people that have supported you all these years. And when they need you the most is how do you take off and run? But I'm very grateful for the ones that stayed. The ones that stayed made all the difference. Because of what I do, it felt like everybody was passing away. Everybody was dying of COVID. But the truth is they weren't. The truth is that was a small percentage. The majority of people that had COVID had very good care and survived. And so I really think that is not only one of the challenges that y'all had was COVID, but I also think COVID is one of the victories that you had.
Yeah, I agree. It helped us kind of level up as a healthcare organization, and what there were protocols that were improved through that time because we
Mhm.
had to look at everything through a microscope. And so the level of safety of care really enhanced itself as we worked through all those problems. So there really were some good things that came out of it.
Yeah, and I what I don't think that the general public understands is much of that was just reinventing the wheel.
Hmm.
There was so much that we had never seen before, you had never seen
Right.
before, and nobody had. It was just where do we go from here? And reinventing yourself as an organization almost on a weekly basis.
Right.
And so once again, kudos to your team. If you haven't bought them lunch, I think you should.
We do. Definitely. We have Thank You Thursdays at the hospital.
There you go, guys. Every Thursday, call
Come on
Lance and we can
over.
show up. All right. So now that South Texas Health Systems has celebrated its 10-year standalone ER here in Mission, how are you evolving to meet the growing healthcare needs of the community? And you mentioned that South Texas is changing and it's changing rapidly.
Right.
So, what is it that you, as one of the administrators of South Texas Health System, sees on the horizon and sees the changes coming? Now, don't give away any trade secrets, but what does the future look like?
Yeah, looking forward is actually the fun part about what we do in healthcare and leadership. I think that there is actually a really bright future for the healthcare that we provide here and some of the exciting things coming up. One thing that I'll share with you is that South Texas Health System is working on graduate medical education. We all know that there are sometimes way too long of wait times to go see a doctor.
Mm-hmm.
So part of what we're committing to is building a deeper bench of physicians in our community. Last year, we opened up a family medicine and an internal medicine residency program
Wow.
with our own ACGME program. We're partnering with Texas A&M, and it's an incredible physician training program. This year, we're adding emergency medicine. So we'll be training physicians in the emergency departments. And so you'll absolutely see physicians being trained throughout the valley and
Right.
including here in Mission.
Well, great. And I like Texas A&M, but don't tell anybody, okay? All right. So when you're training these, I assume that you're training the way you like to do
Mhm.
stuff with your say it again, the AC
ACE it.
ACE it. All right.
Yeah.
And so you're training them that way. So what kind of retention are you having of these doctors? Are you able to keep a few in South Texas Health Systems?
That's the goal. So, it's a 3-year training program
Mhm.
for each of these different programs. So we're in year 1 of the training program, but with the other programs that we've had, we actually have had a family medicine training program with our McAllen campus. And historically, we've had about a 56% retention rate with
Well,
them.
good.
So with the new classes we're bringing in, we're really going to try to keep that even higher so we can keep as many physicians here in our community as possible.
Well, it always helps when you say please. All right.
That's
So
right.
so when you're talking to them, say please.
I will say please.
Be polite to them. That's good.
Absolutely.
Okay. So we're getting close to finishing up here, but let's talk a little bit about the community. You mentioned so many services that y'all have there at the facility. And I assume that as you're talking a little bit general. It's not just the standalone ER, but South Texas Health Systems as a what do we call it? Is it
Health
a
system.
health systems? There we go. So, how do people take advantage of all those services? What would they need to do? Is there a resource that they could call? Is there a number that they could call and say, "This is what I need," and get directed in the right direction?
There is actually. So if you go to the South Texas Health System website,
Mm-hmm.
southtexashealthsystem.org, you'll be able to do look for physicians. So there's a physician directory, and you can look at every single specialist that we have within the health system. You can also call a phone number that is available online when you go to the
Right.
website, and we'll have individuals there to help you. And a lot of times you just don't know where to start. So it's nice to be able to just call and say, "All right, I need this,"
Right. Yeah.
and we'll help guide you to whatever specialty or primary care that you need.
Good. Okay. And I think that that's a big struggle. And I'll say particularly for some men like me that just
Mhm.
don't really go to the doctor very often, you get frustrated. Where do I start? And so
Right.
that's good. Someone that kind of hold your hand and walk you
That's
through
right.
where to go. So
Yep.
fantastic. Okay. So as we finish, you're talking to the city of Mission. Is there anything that you would like to say to the people of Mission as you celebrate this great accomplishment in the city of Mission?
The main thing that we'd like to share is just how grateful we are for your support. Again, being able to treat 200,000 individuals over the past 10 years, it's really an honor for us to know that we've been able to have so many people trust us with their care. And we want you to know that we're excited about the future. There's more coming. It's going to be great. And we're going to make sure that you have access to all the specialists that you need so you don't have to leave and go outside the Rio Grande Valley. We're going to be able to continue providing that high compassion, high love, and at the same time, high level of expertise for the care that you get when you come to our facility. So it's been a wonderful first 10 years, and we're excited for many, many more years to come.
Well, thank you, Lance. I appreciate you being here. And, one of the things you just said was high love. And that means so much to me. It- Part of my business model is just love the people. And the rest will follow, and growing up, my father, he wasn't the best businessman in the world, but he'd always tell me, he says, just love the people. That's all you got to
That's
do.
right.
And he'd try to explain to me, and I've said this before on the podcast. He says, we're not in the funeral business. We're in the people business. And when you say high love, it makes me feel like you're not in the healthcare business. You're in the people business.
That's
And
right.
just care for the people and the rest will
That's
follow.
why we're here.
So I'm very excited. But what a great time to hear about South Texas Health Systems. I feel like I know so much more about what y'all do there, particularly having a cash option, a low cost option for a lot of those outpatient services. That's fantastic, man. And so anyway, I'm glad that we're able to share that.
I'm going to put one more plug in too. So
All right.
we're going to be celebrating a 20-year anniversary this next year. And that's going to be for our children's hospital. Definitely, again, our children's hospital services everyone from all the way to Brownsville, all the way west of here. And again, to have such an incredible resource for our community that's been here for now 20 years.
That is amazing. Now, how are you going to top Monster Truck? Are you allowed to say that yet or not yet?
That's a surprise.
All right, that's a surprise.
See how that goes. But again,
well, if Gravedigger's here, I'm there.
Let's do it.
Well, I'm excited. 20 years is a great accomplishment. Standalone children's hospital. I've been over there a few times. Friends that have children that end up in the ER, that kind of thing. Even the waiting room is pleasant, and I think that that's important. Sometimes you can go and anytime you're dealing with any type of weight, it's miserable. But to go to a place that even the waiting room is pleasant.
Oh yeah. I have 4 kids, so we put a lot of thought into our waiting room, how we could make that better and easier for parents. And we added actually an interactive game on the floor this year, so that, kids that are there with their siblings have a place where they can.
So do I have to have someone that's going to the ER to go play, or can I just walk in and play?
You are officially welcome to come play the game.
All right. So. I'm in. And anyway, thank you again. I'm so grateful for you being here. Please let us know when you have that 20th year planned, because I know that I want to be part of it. I'm sure a lot of the community would want to be part of it. That really is an accomplishment.
All right. Well, thank you so much.
All right. So let's reconnect next time, everybody. And we're going to hear more from other leaders that we can connect you with in our community. Here at the Greater Mission Chamber of Commerce, we believe that your success is our success. We're going to have a word from our sponsors at this time.
What's in a name? When that name is South Texas Health System, it stands for the largest network of healthcare in the Rio Grande Valley. And while our family of names has changed, one thing that never will is our commitment to quality, compassionate care. At South Texas Health System, your health is our purpose. It drives everything we do and inspires us to be among the nation's leaders in healthcare. South Texas Health System, an integrated network of care you can trust.
Once again, thank you to South Texas Health Systems for all they do to care for our community and what they do for the Greater Mission Chamber of Commerce. And I'll even say it. Thanks for bringing Lance Ames down to the South Texas. We're grateful to have him here. Thank you, everyone, for listening to Commerce Conversation, a podcast for business, community, and innovation. If you enjoyed today's podcast, please subscribe to the podcast on YouTube, Apple Podcasts, and Spotify. Don't forget to follow the Greater Mission Chamber of Commerce online for more updates and content. We look forward to having you join us all again on our next episode. This has been Commerce Conversation, Business, Community, and Innovation, hosted by Tim Brown, Rick Brown Family Funeral Home, and produced by the Greater Mission Chamber of Commerce. It was also edited by the Greater Mission Chamber of Commerce. Hope to see you in the next episode.